السلام عليكم. أنا دكتور محمد حيدر. موضوعنا اليوم عن الإير.
The ear consists of three parts: external ear, middle ear, and the internal ear, which is inside the petrous part of the temporal bone. The external ear consists of two parts: the auricle, which is attached to the lateral surface of the head, and the external auditory meatus and the external auditory canal, and ends in the tympanic membrane. The first part of the external ear is the auricle. The auricle is formed from cartilage covered by skin. This rim is called helix. The helix ends inferiorly by the lobule, which is the only part of the auricle that does not have cartilage inside. This fold is antihelix. This fold called tragus, and this is called antitragus. This deep part is the concha, and this is the external acoustic meatus. The auricle is innervated by three nerves: the greater auricular nerve from this side, and the lesser occipital nerve, auriculotemporal part of the mandibular nerve of the trigeminal nerve, while the deeper parts are innervated by the auricular branch of the vagus nerve and also the facial nerve. The external acoustic canal and the external auditory canal is the second part of the external ear. It is a canal lined by two parts. The outer 1/3 is the cartilaginous part, which is from the cartilages of the auricle, and the inner 2/3 are bony parts. The external auditory canal is lined by skin and has modified sebaceous gland that produce earwax or sebum. There are sometimes hair in this region. The external auditory canal is not straight, however have a direction, which is from the external auditory meatus, runs superiorly anteriorly, then superiorly posteriorly, then slightly descent until it ends with the tympanic membrane. The external auditory canal is innervated by its anterior and superior side by the auriculotemporal part of the mandibular nerve of the trigeminal nerve, while its posterior and inferior sides are innervated by the auricular branch of the vagus nerve. This is the tympanic membrane that separates the external ear from the middle ear. The tympanic membrane consists of connective tissue core that is lined from the lateral side by skin, while from the internal and the medial side by mucous membrane. Also, the boundary and the periphery of the tympanic membrane consists of fibrocartilage that attaches the tympanic membrane to the tympanic part of the temporal bone. The middle ear consists of tympanic cavity and the epitympanic recess. Also consists of ossicles. We remove the ossicles to show the boundary of the middle ear. The middle ear is separated from the external ear by the tympanic membrane. and also separated from the internal ear by the oval window. The tympanic or the middle ear is like a box, has a roof, floor, anterior wall, lateral wall, and also posterior wall. The superior or the roof is composed of the tegment tympani, which separates the middle ear from the middle cranial fossa superiorly. The inferior or roof, the inferior side or the roof of the middle ear is separated by bony parts, separate it from the internal jugular vein. While the lateral wall is formed from the tympanic membrane and also superiorly by bone, which is part from the epitympanic recess. The anterior boundary of the middle ear consists of bony parts that separate the middle ear from the internal carotid artery, and also is incomplete because there is the opening for the ossicles tube and the tensor tympani muscle. The mastoid wall or the posterior wall consists of bone and also a aperture here, which is adductus to mastoid antrum. This is the mastoid antrum here. While the medial wall, we should see the promontory, which is part of it, and also the oval window, which is the window of the internal ear. This is the oval window. This is another view of the middle ear. This is the tympanic cavity, and this is the epitympanic recess, while this is the mastoid antrum and mastoid ear cells. These are the ossicles of the middle ear. 3 ossicles: malus, incus, and stapes. This is the malus. The malus consists of the head of malus, which is the epitympanic recess, the neck of malus. This is the neck of malus. This is the handle of malus, which is attached to the tympanic membrane. This is the lateral process of the malus, which is attached to the anterior and posterior malleolar fold of the tympanic membrane. This is the anterior process of malus, which is attached to the anterior side or the anterior boundary of the middle ear by a ligament. The malus articulates from the posterior side of the head with the incus. This is the incus. The incus consists of the body, which articulates with the malus, and also the incus has short process and long process. The short process provide attachment by a ligament with the posterior wall of the middle ear, while the anterior process is curved to be attached with the third ossicle, which is the stapes. The stapes is the third ossicle, has head, anterior and posterior limbs, and the base. The base of the stapes is attached to the oval window of the internal ear. Here are the ossicles of the middle ear. This is the malus. This is the synovial joint between the malus and the incus, and this is the attachment of the incus to the stapes. Movement of the malus will move the body of the incus and then to the stapes, which is attached to the oval window of the internal ear. About the inner ear lies within the petrous part of the temporal bone. The inner ear consists of two parts, the bony labyrinth, and inside of it is the membranous labyrinth. About the bony labyrinth consists of the cochlea, which has the organ of sensation of hearing. The other is assigned for the sense of balance, which is the vestibule and the three semicircular canals: the anterior semicircular canal, the posterior semicircular canal, and the lateral semicircular canal. This is the bony labyrinth. This is another model of the bony labyrinth. This is the stapes. This is the oval window. This is the inner ear and the bony labyrinth, which here is the cochlea, vestibule, and the three semicircular canals: the anterior one, the lateral, and the posterior semicircular canals. This enlargement is the ampulla of the semicircular canals. This is about the bony labyrinth, or the bony part of the inner ear. About the membranous labyrinth is the cochlear canal, which has the endolymph and surrounded by perilymph, and transmit the sense of hearing through the cochlear nerve. Other parts of the membranous labyrinth are three semicircular ducts, which are inside the semicircular canals and surrounded by perilymph and has endolymph inside of them. We also have the utricle, which is largest of the two sacs and is connected to the three semicircular ducts. We also have the saccule. This is the saccule, which is connected from the inside with the cochlear duct. The utricle and saccule will give these branches to the vestibular nerve. Then the cochlear nerve and the vestibular nerve become one nerve, which is the vestibulocochlear nerve. We talked about it in the previous sessions. About the function of the inner ear, the three semicircular canals detect movement in any direction, while the utricle detects the vertical acceleration and the saccule detects the linear acceleration. About the sense of hearing, this is the tympanic membranes, which moves corresponding to the mechanical vibration which comes from the sound from the environment. As the movement of the tympanic membrane, the handle of malus will also move because it is attached to the tympanic membrane. After movement the handle of the malus, the head of the malus is also moved, which in turn causes movement of the incus. The movement of the incus will cause movement of the stapes. The movement of the stapes will go and provide pressure to the oval window, which is attached to the vestibule, and then this causes the perilymph to move inside the cochlea, which in turn will cause the sensation to be transmitted to the cochlear nerve and then to the vestibular or cochlear nerve. Here we finished and studied the ear, external, middle and inner ear. If you have a question, please comment. Thank you for listening.